Good afternoon. This is Susan Bernecker with Health Connections, coming to you every Wednesday at 5 o'clock right here at WGSO. And another great show coming to you today. We're going to talk a little bit about a trend that is happening right now in obesity and weight loss. There's like 100 million Americans today with obesity and turning to experimental weight loss drugs. And you probably know what I'm talking about. They're classified as the GLP-1s. And those include the Ozempics and the Wegovy's, and people are trading these for health problems. They're trying to get the weight off to get their health problems in order. And today I'm going to have on a pharmacist, and she's an integrative health expert, Dr. Swathi Varanasi, I hope I said that correctly, and is joining us to break down the lesser-known dangers of these type of medications and how we can mitigate the risk. And I wanted to say a few things before I'm going to say Dr. Swathi. It's easier. And before she comes on, I want to give you a little background on her. She is an award-winning healthcare professional recognized for her work on the forefront of personalized medicine and healthcare innovation. She has a doctor of pharmacy from the University of South Carolina and was the first pharmacist in the United States to complete a postdoctoral residency in integrative medicine and preventive health. And she has done a lot of things. Her credentials also include a postdoctoral fellowship in biotech and nutrition from Cornell University. So her experience spans patient care, biotech, clinical research, academia, and consumer product goods. And Dr. Swathi is a scientific and medical advisor, and she's a consultant to companies. And she's done a lot of research in peer-reviewed academic journals. And boy, I could go on. And Dr. Swathi, are you there?
Yes, I am. Thank you so much for the warm introduction.
Yes, you've been a busy lady. So I was glad you came on today because I've been wanting to bring this to the forefront because all you hear about is how many people are doing it and look at all the weight they lost and all that. But we got to talk about, there's a downside and potential risk for these type of things.
Absolutely. Yeah, let's dive into it.
Yeah, sure. Okay, for instance, what would you say would be the number one, or they're finding as the number one risk factor by taking these drugs? But I know, you might want to talk a little bit about it's made for people with diabetes, correctly?
Yeah, so I can start a little bit about the drug class in general. So the GLP-1 agonist GLP-1 is actually an acronym. So it's glucagon-like peptide 1 is the name of it. And it's an agonist, which means, it's already a hormone that we produce in our body. So GLP-1 is naturally occurring. So the idea of this drug is that we include the drug into our routine so that it stimulates this hormone and that it plays a crucial role in glucose metabolism and appetite regulation. And so what this means is, after we're eating, the GLP-1 is released. And so if we are, enhancing the effect of GLP-1, this can actually help us maintain our blood sugar level at more of a baseline. And it can also, if we, have a higher level of GLP-1 floating around in our body, it actually can suppress appetite. And so those are like two of the reasons why these drugs are positioned to do really well for weight loss.
Yeah, and on that point, point, this drug was made a long time ago, correct? And we've had it around for years.
So the drug is relatively new, like in the past decade. It was approved, and it was, so the first drug that was FDA approved in this class was FDA approved for type 2 diabetes. But again, this drug is not for everyone, right? So it is specifically for people with type 2 diabetes who are already on other type 2 diabetes medications like metformin, so it's thought of as an add-on therapy. And they found when they were doing the clinical studies that, wow, not only are people, being able to better regulate their blood sugar, they're also finding out that they are losing up to 10 to 15 to 20% of their total body weight. Yes. So then they went back and said, okay, let's look farther into that. And they approved what's called Wegovy, which is the same active ingredient of Ozempic, but at a higher dose, and it's specifically FDA approved for weight loss. But again, only if you have specific parameters, like you have to have a BMI of 27 plus another condition, or a BMI of 30 for it to be, classified as, you being in the right population for the product.
So it's really made for people with these conditions,
Yes.
and high BMIs, diabetes. I'm sure there's a couple of other diseases in there, but to maintain their blood sugar, to get their weight down, because if not, they have another bad thing that can happen to them. But we're seeing so many people who don't have anything wrong with them wanting to get this drug.
Right, and that's the problem, is that, some of the misconceptions about this drug is that it is a magic bullet, it's going to work instantaneously, that it's the right fit for every single person, which we just talked about is not the case, and that it's free of side effects.
Right. And there's a lot of red flags to this. I know a couple of people myself personally that do not have diabetes, and they've used it, and I try to stop them. And one of the things I heard from all of them was the gastrointestinal symptoms.
Yes, exactly. So the great thing that you mentioned the red flags. So the first one is the gastrointestinal issues that I want to talk about.
Yes.
So this could be nausea, vomiting, constipation, diarrhea, and potentially issues with the stomach not emptying properly that could lead to chronic or long-term digestive problems. So that is the first one, and arguably the most common that people are seeing and starting to talk about. But the other three are really ones that are very much overlooked.
Yes, and they're cramping in their abdomen. They're throwing up. They feel miserable. They're in the fetal position. I mean, I've heard all of these things.
Yes, and exactly. And what we're not seeing, we see all of these, famous people, celebrities taking these medications, and all we see is what they look like on the red carpet. We don't actually see behind closed doors. They might also be dealing with these same GI issues.
I think so. They're not going to say it. They're not going to talk about it.
Not.
Like, oh, I got to look like this out of misery. But it's not just misery, too. I mean, these drugs are for a specific reason.
Yes, exactly. And that's why it's so important, and this speaks to one of the other red flags, is off-label misuse. So as we talked about, these drugs are only FDA approved for certain people. And
so how is everybody getting it? I mean, everybody can get a hold of it? You have to have a prescription.
Medication? Yes, exactly. It is a prescription medication. However, it's up to the clinical discretion of the healthcare provider who's writing the prescription. So if they decide, this is something I want to do for this patient, or this is going to help my bottom line, or whatever their reason is, there are, it's up to the provider to write it. Whether or not that is the correct decision is really up to them and the decision that they make with the patient.
Right. And then also I've read that there's muscle loss when you do these drugs.
Precisely. That's one of the other red flags I wanted to mention.
Yes.
So when people are losing weight, and of course, it could be 10, 15, 20% of your total body weight, the part that people are not talking about is that this weight loss is actually a combination of fat and muscle loss.
Yes.
And especially in the last decade, a lot of the research around longevity and aging powerfully and having a healthy lifespan is coming down to how much muscle these people have, right? So,
right.
So that's something that is of high concern that I still don't see enough people talking about.
Yeah. So for the last 20 years, doctors are telling us as you age, you need to start doing weight-bearing exercises. You need to pick up some weights. You need to do some resistance, all of that type of thing. But then if you go and do Ozempic or Wegovy, you're going to lose fat with muscle. Am I correct?
Yes, exactly. Because, what the advertisements are saying are, yes, you could lose, 10, 15, 20% of your total body weight, but the total body weight is not just that. And so it's a really important point that is just being left out in some of the marketing right now.
I think they're doing that on purpose. They don't tell you that you lose your muscles because really, if you're aging and you're at that point, maybe someone in their 60s where they're really starting to maybe lose muscle, that would be not a good time to be going on that.
Exactly. And that's why, one of the questions I get is, who should be most concerned about muscle loss from a GLP-1? And in truth, anyone should be concerned about the muscle loss because it can start happening as soon as a few weeks into the treatment. But you are right. After a certain age, particularly like 40 and above, that's when the body starts to build muscle more slowly, and we just naturally lose more muscle over time. So as much as, everyone needs to be concerned about it, particularly if you're over 40,
Right.
it's something really that your healthcare provider should take into account before prescribing it to you.
I'm sorry, we're going to go to a break and we'll be right
Sure.
back. We're talking with Dr. Swathi, and today we're talking about the trendy drugs for weight loss like Ozempic and Wegovy and the risks that are involved in it. And we'll be right back after this message. And we're back. You're listening to Health Connections right here on WGSO with Susan Bernicker every Wednesday at 5. And today I have with me, we're having a conversation. I think a lot of people need to have this conversation. And we're discussing the GLP-1s, which is the Ozempics, the Wegovys, and they have a few other names for them too, with Dr. Swathi. And Dr. Swathi is an award-winning healthcare professional. Her experience spans patient care, biotech, clinical research, academia, consumer product goods, and it goes on and on. We can spend half the show just reading her resume. and we had mentioned before the break that we were discussing some of the red flags associated with taking these particular drugs, these weight loss drugs. And the first one was gastrointestinal, that we were talking about, that people get pains and all the things that go on in the digestive system. What I wanted to ask you about that, what could people do to prevent those complications?
Yes, so there are quite a few things from a nutrition or a diet perspective that people can do. So if people are taking these GLP-1 drugs to try to mitigate some of these GI issues, what I recommend is frequent meals and focus on, the whole foods that you're consuming. This could be fish, this could be meat, this could also be vegetables, and not forgetting about fiber, because fiber really helps our digestive tract work, and it helps us, be regular as well. So if we want to prioritize small, frequent meals and thinking about how we're optimizing for protein and for fiber, with lots of plants would be the way to go.
While you're on that drug.
Yes, while you're on the medication. So that will help mitigate some of the issues, the GI issues. But in general, that is also really great advice if you're on the drug and you're not having the GI issues, to just ensure that you're hitting the protein requirements as well as the fiber requirements per day.
And the protein is important for which? The muscle?
Yeah, protein in particular is important for the muscle preservation, but it's also really important for satiety and feeling full. Satiety is just a fancy word for feeling full and feeling satiated when you're eating. It really comes from eating enough protein. And of course, that could be animal protein or plant protein, just protein sources in general that are from naturally occurring sources.
So there's a possibility that there's a lot of people who are doing this. Maybe they have no symptoms, but I've heard about a lot of symptoms.
Yeah, no, it is very possible that someone is, on these medications and doesn't have any symptoms, or any side effects rather, but these are pretty common side effects that I'm mentioning.
Mm-hmm. And we mentioned a little bit about muscle loss. And who should be concerned if they're on these weight loss drugs? Who should be concerned about the muscle loss?
I say anyone should be concerned about the muscle loss because they can happen as early as a few weeks into the treatment. But in particular, anyone over the age of 40, because, as we age, it's really important to think about how we are going to bolster our muscle health for the long term. And some of that comes from nutrition, but also some of that comes from, working out. And I know people don't really like those two words, but
yes.
really is finding an exercise that you enjoy. And it should be a multi-prong approach where at least 50% of that exercise, in my opinion, should be aerobic. So you're getting your heart rate up, you're taking the dog for a long walk, you're, trying out different types of exercise that gets you excited. Because I'm not going to recommend one type of exercise for everyone. It's whatever gets you active and your heart rate up is one half. The other half that's really important is how can we do resistance training or use some weights in what we're doing. These could start with 1 pound weights. I think when I say weights, people get intimidated. I don't mean, the weights that you see.
Even
the
small
weightlifters
weights are good,
doing.
as long as
Even
you're creating.
starting with small weights.
Yeah, even if you're just creating a resistance.
Correct.
I noticed in your notes, I was reading some of your notes, that healthcare providers, the people they put on these drugs, these weight loss drugs, they should add some other things as well, as far as like the muscle loss and things like that. I think you mentioned fortotropin. What is that?
Mm-hmm.
What is that?
Yes.
Fortotropin? Is that how you say it?
Yeah, fortotropin is the way you say it. So it's something that you might not have heard about yet because it's newer, but it is highly studied. It's a natural compound that's derived from fertilized raw egg yolk, and in clinical trials, it showed that it boosted muscle protein synthesis by upwards of 18% in adults who are not exercising.
Wow, that's pretty good.
Exactly. And so I think it's a great part of, a lifestyle change that includes, the nutrition that we talked about, a little bit about the movement that I mentioned, and where you really can benefit your muscle health from a lot of different strategies.
Yeah, we lost you for a second there. I don't know if you're on a cell phone, but you kind of went out for a second.
Oh, sorry. Yeah, I'm happy to repeat it. So fortotropin is a great part of a multi-pronged strategy wherein, you're incorporating some of the information I talked about as per nutrition, some of the information I talked about as per movement, and then supplements like fortotropin, which you can find in a product called MYOS MD, MYOS MD. And if you want to learn more about the studies, like the one I mentioned, you can also find that at myosmd.com.
So MYOS MD, that is another name for it?
So MYOS MD is a supplement that has fortotropin in it. So it's a single ingredient supplement that has fortotropin. I'm actually on their medical advisory board, so I do a lot of education for patients and for healthcare providers on muscle health.
Oh, that's great. So if someone's on it, they can ask their healthcare provider to maybe ask them about that, to add it in?
Exactly. Mm-hmm.
And so that you don't need a prescription, though.
No, you don't need a prescription because it's a supplement, but I do think it is a great choice for someone who is taking a GLP-1 agonist to use in addition.
And so what it does is it helps, it's a compound that helps boost the muscle health?
Exactly. Mm-hmm. Yeah,
because you're losing it. You're losing it while you're on these drugs.
Yes, exactly. And that's just inevitable if you're taking these drugs. It's just something that is going to happen. So how can you think about these different strategies that can support your muscle? And one of them is as simple as just taking the supplement.
So that'll be added. But, a lot of people don't even believe it. I've told people that, and they said, well, I never heard that about losing the muscle, because I don't think that you hear it advertised or anything like that.
Right, and that's why it's so important, the work that I'm trying to do with educating the patients, but also educating the healthcare providers who are the ones that are prescribing the medication. It needs to be a part of the discussion with, a potential patient of, these are the risks going into it.
Yes.
And it's just not flashy or exciting to say that you might lose some muscle.
It's not exciting to say you're losing your muscle while you're on that.
Right.
Okay, look, we're going to go to the news in just a second. We're talking about the new trendy weight loss products that are out there that the doctors are prescribing, the Ozempics, the Wegovy's, and we're talking about the risk and also some things you can do about it with Dr. Swathi. And you're listening to Health Connections. If you want to call in and ask her a question, the phone number is 504-556-9999. 9696. Okay, we are back. You're listening to Health Connections with Susan Berniker right here every Wednesday at 5 o'clock. Today we're talking about some risk concerns and also some things that can help us with people who are taking Ozempic, Wegovy, the GLP-1s, agonist, and we're speaking with Dr. Swathi. She's an award-winning healthcare professional. She has experience that spans patient care, biotech, clinical research, academia, and consumer product goods. She is a scientific and medical advisor and consultant, and I'm glad to have her with us today. We have gone over two of the red flags associated with those weight loss drugs, and one was the gastrointestinal issues, and the second one was the accelerated muscle loss. And we talked about fortotropin is a great supplement that can be used when you're taking these to help with the muscle loss. That's correct, Dr. Swathi?
Yes, exactly.
And so what's another red flag?
So another red flag that we haven't talked about yet is actually we have briefly discussed it, which is the off-label misuse. So off-label just means, it is being prescribed to patients for whom it is not FDA approved. And so, as we mentioned, it's only FDA approved if you have a certain BMI and certain what's called comorbid conditions, which means that you just have another condition that can potentially contribute to your disease. So if it's obesity or if it's type 2 diabetes, that you have another condition like heart disease that could also contribute. So you have to have a BMI of 27 and one of these other conditions, or a BMI of 30 for you to technically qualify. But this off-label misuse means that, healthcare providers are still writing this prescription for people who don't fit into those categories.
Oh, boy. And that means somebody that wants to lose 10 pounds.
Right.
Or 5 pounds, or, and so what's likely to happen? Like, okay, you don't have diabetes, you're not overweight, you're not obese, and you take them. I mean, what do you see happening?
Yes. So that is part of the issue with this off-label misuse, is that first and foremost, the research that has been done to support the drug in general for it to get FDA approved are really only in those patient populations. We actually don't have research about how it's going to impact people with different BMIs.
Oh.
That being said, a lot of people are just extrapolating and saying, okay, if it's going to help people with a higher BMI, how come it can't help me too? And so far, at least anecdotally, we're finding that, yes, people with a lower BMI are benefiting. However, we don't have the concrete research and all of the fancy lab work or any of that to really understand what it means for those patients, which is a little bit of the reason why I'm concerned with this off-label use for people who have lower BMI.
Oh, boy. So we don't really know yet the effects.
So we don't know for those patients, exactly.
People who are using it for temporary, what I would call cosmetic results or something.
Cosmetic, exactly. That's a great way of saying it.
Yeah. I mean, there could be long-term health damage.
Exactly, and that brings me to the second point, is that we don't have the long-term data yet because these drugs are relatively new. So this long-term data component has to do with the GLP-1s in general, but they also have to do, so the GLP-1s in general regardless of your BMI. So that's another component, is like whether or not it's off-label use. We actually don't have the long-term data yet to understand what these GLP-1 drugs are going to do to the body. So that's also just something to keep in mind. And that being said, it is something to keep in mind with any new medication that comes out, is that oftentimes we don't have the long-term data. But more concerning than anything is that we just don't know how it's going to impact, people with a lower BMI for now.
And not having the long-term data, I mean, it also, that's really addresses everybody that takes it. And but those that really need it probably have such a bigger problem that they feel like this will help them get out of the other problem, right?
Exactly.
So We don't know what the people using it for temporary reasons. We have no idea the damage that can be done. Or do they know anything?
It's interesting that you use the word temporary because actually the way that it's FDA approved is that the patient is supposed to keep taking the medication for the rest of their life. It's supposed to be for long-term use.
Oh, wait. So, I didn't realize that. So when they put someone with diabetes on the Wegovy or the Ozempic, they're supposed to just stay on it.
Yes. At least that's the way it's FDA approved for now.
And so you have people just taking it randomly for a short time, just to I just want to lose a few pounds, and so we don't, and so it's not made that way.
Exactly, but what we are learning is that people who are stopping taking the medication for weight loss, they are gaining back the weight, if not more weight, and so it's actually having what's called a rebound weight gain effect.
Oh, so this is not good. If you want to lose a dress size and you don't have diabetes and you don't have anything wrong with you, you shouldn't be taking it, huh?
Exactly.
Oh boy. So how do we reduce that risk?
How do we reduce the risk?
The risk of the off-label misuse.
Yeah, so the best way is to work with a healthcare provider that is going to do a full assessment of your BMI and your treatment goals and help you understand if this is the right choice for you. It has to come down to communication with the healthcare provider and the healthcare provider also making a sound decision that is in the best interest of the patient.
Okay. We have a call. You want to take a question?
Sure.
Okay, let's go to, we have Cherie. Hi, Cherie, you're on with Dr. Swathi.
Hi.
Hello.
Hello, we can hear you.
Hello. Hi, yes. Hi, doctor. I have a question for you, if you don't mind. It's really interesting. I have a friend that's been on the Ozempic for a few years now on diabetes and lost about 20 pounds. And has been the same weight for the last 20 years. But if she's noticed, and we were talking about this overall, it felt like her skin has changed significantly, like lost connective tissue or something. Is that like collagen loss? Is that happening, just happened like...
Does that happen from the drug, you mean?
Yes.
Mm-hmm.
Seemed like it accelerated. She's 51 years old, and just wondering if Ozempic has accelerated it.
Very interesting. Yeah, thank you for the question. So, as per skin and connective tissue, when we do lose weight, it is possible that, if we are losing the fat, losing the muscle, that we can get loose skin. So that could be part of it. Also, when we lose fat and lose muscle, there are different types of fat that we lose and different types of muscle that we lose. So one of the types of fat is called subcutaneous fat, which means that the skin can appear less plump if we're losing that kind of fat. So those could be two of the types of, ways that we lose tissue. You specifically asked about collagen and elastin, or collagen, but really collagen and elastin are key proteins in the skin and connective tissue that provide the skin structure and elasticity. So if we are losing significant weight, it is possible that this can impact the amount of collagen and elastin. As of now, I don't actually know any specific research that's out there to support this, but it makes sense from a theoretical standpoint, just thinking about the way the drug works. It is possible.
Yes, because you were stating earlier that we don't have any long-term studies on these drugs yet.
Unfortunately not.
So we're going to find this one out later.
Yes, I guess I can kind of see, while they're probably not, they're dropping weight quickly. So I guess you're not hydrating and keeping proteins and fat.
Now, that's a good question. What about hydration and using this?
Hydration is so important, particularly if you're on these medications and if you feel like you're having changes in your skin, because so much of skin, the way that our skin looks, comes down to how much water we are consuming. And so you need to have adequate hydration. I would say if you're on these medications and if you're on a weight loss journey in general, that even up your water intake. And I don't mean just any liquids, like as clear the liquid as possible for water would be the best. And then, hydration is not just what we drink. It's also what we were talking about with nutrition and these small, frequent meals. Thinking about what you're putting on your plate, a lot of vegetables and fruits are water rich. So I always talk about not only drinking your water, but eating your water too.
Right, and the fiber helps too. You said to have small, frequent
Absolutely.
meals when you're on
Fiber
this.
is so important. The average American is deficient in fiber, and so any way we can incorporate additional fiber into the diet is really going to benefit our digestion and help us feel fuller, help us feel more satisfied, but also just help the way that, our body is looking to.
So you mentioned earlier in the first half of the show that you should have small, frequent meals and get a lot of protein and plants, and then also take, I forgot the name of it already. Fortropin.
Fortitropin, yes.
Fortitropin. It's a supplement, and it helps you synthesize the protein, right?
It helps you actually build more muscle is the short version, yeah. So it helps really improve and bolster muscle health. And then I also recommend 2 other supplements, too, that people might have heard of, like omega-3 fatty acids. Again, you can eat those, like in salmon or in chia seeds. But, of course, you can also get them in a supplement form, and that can really help reduce inflammation and support the same, type of protein synthesis.
Okay.
And then the other one is amino acids. You probably have heard of and seen that in, drugstores of just taking a supplement of amino acids, specifically branched chain amino acids, like a subcategory of amino acids.
Right.
And those really help with preventing muscle breakdown. So the combination of those 3 can be really beneficial.
Okay, good. We're going to a quick break, and you're listening to Dr. Swathi, and we're discussing the new trending Ozempic and Wegovy drugs and what to do, what to help with it, and what not to do. And we want to thank you, Cherie, for calling in. And we'll be right back right after this message. And we're back. You're listening to Health Connections with Susan Bernicker right here every Wednesday at 5 o'clock. Today, we're talking the good and the bad of the new drugs for weight loss and their risk and what we can do about it. With Dr. Swathi. She's an award-winning healthcare professional. She has experience in patient care, biotech, clinical research, academia, consumer products. She works a lot with she is a scientific and medical advisor and consultant. And when we left, Dr. Swathi, we were discussing, the lady had asked us about what things to take, and you were really going on, you said also amino acids.
Yes, exactly. So I mentioned 3 supplements. Fortitropin we already discussed, but the other 2 are omega-3 fatty acids. So you might have heard of those from, like the foods we're eating, like salmon and chia seeds or flax seeds. But also amino acids are wonderful that you can find in a supplement, like branched-chain amino acids specifically really help support the muscle.
Okay, where can we find Fortitropin?
Yeah, Fortitropin you can find at MYOSMD.com. So that's MYOSMD.com.
Is that a line of supplements or?
Yes, so MYOS MD is a line of supplements. They specialize in Fortitropin, so this one active ingredient.
So if you're on Wegovy or you're on Ozempic or any of those GLP-1 agonist, this would be suggested to get on that to help fight the muscle loss.
Exactly. To get on this, and in addition, what we talked about nutrition and movement. So it has to be that multi-pronged strategy that works the best for the patient.
Mm-hmm. Okay. I wanted to talk about something else because, we were talking about the people who need it and the people who are just taking it just to lose a dress size or cosmetic reasons. What would be another red flag?
The final red flag is that, I think is also very important is the mental health side effects. So people who are taking these GLP-1 medications, how is it impacting their mental health?
Right. Right. And if they're feeling bad, that's going to impact their mental health as well.
Exactly. And so this again comes back to when a provider is evaluating, is this the right, fit for this patient to understand what is their mental health history and is this the right fit? Because what we're seeing in some new case reports is that, the GLP-1 drugs are affecting mood swings, for example.
Oh.
And at the end of the day, GLP-1, that is a hormone in our body. So if we are impacting a hormone like GLP-1, that is going to, downstream effects also influence other hormones in the body. So if there are other hormones being influenced, then that can really impact our mood.
Oh, boy.
The other thing, yeah, exactly. And the other thing is that, a lot of the newer research is coming out talking about if we are changing something in the gut, there is that inextricable gut-brain connection.
Right.
So if we are altering what's going on in the gut, then we are going to inevitably impact the brain too.
Right. And that's going to be one of those long-term studies because if it's difficult, what if you're taking it just to lose 5 or 10 pounds and then you get off of it and then you get on it later again and you keep going like that, and you're saying it affects the hormones.
Yes, it can. And, as we're losing weight too, the way we perceive our body, what we think about ourselves, there's a lot of layers to, our body changing. And so that's another component of mental health. And if a patient is ready for these kinds of changes to happen for them.
Right. I've heard some of this. I don't know if you know anything about this, but I've heard about some Ozempic babies. Have you heard that?
No, I have not heard about this. Please tell me what you're talking about.
Well, there's somebody was telling me about this that due to improvement in fertility, if they lose weight, and some people are taking Ozempic when they're pregnant or before they're pregnant.
Wow, that is very interesting. It's definitely something I need to think more about, but just from a theoretical perspective, as we're losing weight, yes, it is very possible that can improve our chance of being more fertile, because oftentimes, being overweight can be one of those factors that gets in the way of getting pregnant. So theoretically, I could see that working. The other thing that, just the way that oral contraceptives work specifically. Of course, there's many types of contraceptives that people can take, but the oral ones in particular, just because they do work in the GI tract, it is possible that if you're taking a drug that is influencing the GI tract, that there could be some sort of interaction there, but I would need to look into it.
Yeah, because I read something about, now, I don't know exactly, but I remember the gist of it, that women struggling with infertility on birth control, that they took Ozempic, and I think they got accidentally pregnant.
Well, theoretically, it could make sense if you're taking an oral birth control pill. It is possible. Mm-hmm.
Because once again, I didn't know it, but this is affecting your hormones. These drugs.
Mm-hmm.
And that's what a lot of people don't know. The people that I personally have discussed it with, they're not discussing hormones. But if you want to explain again what GLP means.
Yes, GLP means glucagon-like peptide 1, which is just the name of a compound that we're already producing in our body. It's generally produced once we're done eating. And so it's a hormone in the body. First and foremost, yes, we naturally produce it, but it's a hormone that tells our body, all right, we've eaten now, and let's help get our blood glucose together so that we can now deal with the food that just came in the body. And GLP-1 also is a part of the, entire pathway that leads us to feeling full or satiated.
Right. So what I was discussing about the lady getting pregnant, that might be something you want to look into. So if you're taking hormones and then you add in an Ozempic or a Wegovy, then you're taking in more more hormones. So you might be
Correct. Mm-hmm.
making an imbalance, which would really cause a mood swing, probably. And maybe that's how they got pregnant. I don't know.
Yes,
Or not
possible.
pregnant. It could work both ways.
Potentially, that's the thing, right? We don't fully know, but theoretically, I think that there could be some evidence there. I need to look into it.
Yes, that'll be something you need to look into. And we're almost out of time. I want to thank you, Dr. Swathi, for being with us today, giving us a little insight on these new weight loss drugs. You have any last 20 seconds what to say?
Sure, yeah. If you are interested in taking a GLP-1 drug or you're already taking them, think about it as one of the components of a full, comprehensive, treatment plan. So take GLP-1s, but think about what we talked about today with nutrition, with movement, and with supplements.
Okay, and our show will be saved on my podcast if you want to hear it again or you missed part of it. Go to WGSO.com, go to Health Connections, and we'll save it there, and we'll put Dr. Swathi's information there as well. And thank you so much for being on with us today, Dr. Swathi.
Thank you so much for having me.
Okay, and now I'll see you guys next Wednesday at 5 o'clock. You've been listening to Health Connections right here on WGSO. If you want to contact me, send me an email at susan@wgso.com.